Hi, this is Dr. Ron Klatz with another edition of Immortality Now, sponsored by the American Academy of Anti-Aging Medicine.
The American Academy of Anti-Aging Medicine is the world's largest society of physicians and scientists focused on longevity, and since the first meeting in 1991, our international membership of over 30,000 have come to understand that aging is not inevitable, aging is a treatable condition, practical immortality, health spans and lifespans beyond 120 may be available to us as soon as 2029. A4M doctors specialize in new, innovative and cutting-edge technologies, all designed to improve both health span and lifespan. I hope you will join us on our mission to end aging-related diseases.
We are with Dr. Michelle Weiner, and she is a specialist and expert in pain management and quite a renowned expert in cannabis, a new invention in medicine. And she's going to share with us how this new therapy, which is just coming online, can be a benefit to so many people who suffer from pain, anxiety, a whole myriad of problems associated with quality of life. And quality of life is very important, especially if you're going to be living to age 100, 120, 150. My co-host today is Carol Petersen. Carol is a world-renowned compounding pharmacist, expert in hormone replacement therapy. Carol, tell us about Dr. Weiner.
Thank you. Dr. Michelle Weiner comes to us. She's board certified in pain management and physical medicine and rehab. And this brought her to eventually using plant medicine and lifestyle changes to treat pain rather than the usual route of opioids and narcotics. So, Dr. Michelle, could you tell us about your treatment protocols, what you see in giving people pain relief?
So, initially, I was an interventional pain management physician. So I was doing typical injections and prescribing medications. And I got very frustrated with the Band-Aids that I was using. And I wanted more tools in my toolbox. And so I started using medical cannabis about 6 years ago when it became legal in Florida. I was one of the first physicians, and I tried to learn as much as I could. I thought that this could potentially be a substitute for opioids. And I did my own research and saw that that was actually the case. And a lot of patients were able to wean off their opioids. They were able to add the cannabis to their pain medication. But what I found was that they were coming back saying not only was my pain improving, but I was sleeping better, I was less depressed, I was less anxious. And so it opened my practice up to not just treating physical pain, but also emotional pain. And I had a very large population of fibromyalgia patients. And being that I'm interventional pain in a big practice that other physicians are able to do the injections, I really started focusing on the chronic pain central sensitization population. And it's just really something that we haven't touched yet because the research is behind in the United States because it's a Schedule I drug. So what I do is I really help patients and educate them, get rid of the stigma behind medical marijuana, and then personalize their regimen. And so people really have no idea what to do once they get their card. And that's a huge danger because they could use THC and have a bad outcome. They could use CBD and think that's going to be effective, and it's not. And so I really give them an algorithm for whatever type of condition they have, how to personalize it so that the THC is minimizing the psychoactivity, and we're treating really the whole person, not just the actual pain they're coming in for.
Very briefly, and I know it's hard to be very brief with this, but could you explain the cannabinoid mechanism, the pathways? Because very few people, and unfortunately, very few physicians understand it because it's so new.
Sure. So we all have an endocannabinoid system, and we should be teaching this in medical school, and all physicians should know this. We make naturally occurring cannabinoids that we call endocannabinoids. They're made in the body on demand, and they're made from our food, from free fatty acids in our body. Then we have certain enzymes, like the Fa enzyme, that breaks down these endogenous cannabinoids, and they activate cannabinoid receptors. So we have CB1 receptors in our central nervous system, CB2 in the periphery and the immune cells, and the main purpose is to keep our body in balance. And that's so important. That's why we can use one plant to control so many different symptoms. And really what happens is it's a retrograde system. It's the only retrograde system in our entire body. And the other thing is it's actually the most common.
What do you mean by retrograde?
So, for example, if someone's having a seizure or having pain, we can use cannabis and it will tell the body to either produce more or less of that neurotransmitter. So it's the only retrograde system in our body. And actually our cannabinoid receptors are the most common G-coupled protein receptor in our brain. And so
it's like an adaptogen. The body,
Yeah.
it'll adjust itself,
Right.
whether it needs to be up or down.
We have an endocannabinoid tone, and so we all have our own tone. And we get things like endocannabinoid deficiencies, that's like fibromyalgia, IBS, chronic fatigue. In a time of trauma, people are taking too many pharmaceuticals, different toxins, and we have a imbalance in our endocannabinoid system. People who take too much cannabis at the same time also have an endocannabinoid system dysfunction because they're not able to regulate it because their cannabinoid receptors are basically saturated by using too much THC. So the tone is really important for maintaining homeostasis in the body.
What's interesting to me is that at one time, cannabinoids were the most widely prescribed prescription medication in America. That at one time, before the DEA came around and
Made it a Schedule 1.
exactly, I think there were over 400 different pharmaceutical
Synthetic forms.
forms.
Right.
Yeah, not even some of them natural, some synthetic. But you could go to a pharmacy and you could get 400 different prescription drugs put out by the major pharmaceutical companies. I remember when I was working in pharmacy a million years ago, when I was a very young man, and there was this big brown bottle. I mean, it was a big brown bottle, and it was from Merck Sharp and Dome, and it was cannabis capsules. And that was, I think it was circa 1920.
Right.
What I'm alluding to is this is a very safe drug that has been maligned for not the best reasons, not the best scientific reasons.
Right, and it's actually so safe because the receptors aren't in the area that controls respiratory drive. And that's why there's no toxicity, nobody can overdose from cannabis. We just have to educate people so they understand THC dose and also how to use CBD to mitigate the intoxication.
This sounds like you have a whole palette of types of products you might use. I think that's one of the most confusing things for people who are novices is what to choose, how to choose. So you're able to offer some guidance on how you choose a product to help your pain and keep on top of that patient in order for them to have the best possible relief from the products they're using. Is that
Yeah,
correct?
so it's always, more conservative, starting low and increasing slowly, but on a consistent basis. So CBD from hemp or marijuana is a possibility, but CBD as an isolate is not going to activate the cannabinoid receptors. So you actually need THC to activate those. What CBD does is it inhibits that enzyme so that we produce more of our own naturally occurring cannabinoids, keeping us in balance. So CBD is really a wellness supplement that everybody should be using. The question is, should you use it in an isolate, broad spectrum, or full spectrum, which basically just means, are we adding in other cannabinoids? Are we adding in less than 0.3% THC, which is the legal limit? So people usually have more of a benefit from a full spectrum product. Now you'll see other cannabinoids being studied like CBG, CBN, and then using the terpenes from the plant to guide the effect. So if you want to improve your sleep versus pain, that's going to be a different terpene profile. So now many companies are taking those terpenes, adding them to the CBD so that you can have a similar effect without needing the THC, so that we don't have to have the intoxication.
But even with THC in there, as long as the amount of THC is low enough, there's no intoxication whatsoever.
Well, everybody has a different endocannabinoid system, and everybody has a different tolerance to THC.
I see.
And when you add CBD with THC, especially in a higher ratio, like a 3-to-1 or 5-to-1 ratio, it will mitigate the intoxicating effects. Obviously, a CB1 antagonist is the only thing that would block the THC intoxication, but it would block all the other benefits as well.
Interesting. And I know that the field of pain management is expanding beyond simply hemp or marijuana. It's moving into psychedelics, which is also very exciting. Mm-hmm. Perhaps you could talk about that, because I know that you're at the forefront of that research as well.
Sure. So ketamine is a dissociative anesthetic. It's not technically a psychedelic. The classic psychedelics activate the 5-HT2A receptor, one of our serotonin receptors, and that's such as psilocybin, LSD, mescaline, DMT. Those are all classic psychedelics. Those are all a Schedule 1. Right now, they found out that after using ketamine in the OR, patients were waking up and feeling less depressed, and they started to look into using ketamine for mental health. And it is actually approved for treatment-resistant depression. There's an intranasal spray called Spravato that some providers use. Now we're using ketamine off-label for many things, and the mechanism is it blocks the NMDA receptor, so it's affecting glutamate more so. But there's also the neuroinflammation that is being decreased with ketamine, as well as the experience that the patient is having, which is a huge component. So when we use psychedelics, we talk about setting, and dose. So you can't just have a physician's office and having patients do ketamine while everything else is going on in your office. That's not a proper setting to have a very profound, meaningful experience using ketamine. And then also the route of administration. So we're used to ketamine infusions for pain, and I do those 2 to 3 hour infusions depending on how the patient's feeling and how they respond to it. But for mental health, we're looking more at intramuscular injections or even oral route of administration of using ketamine, and then working with a team. So I have a therapist that I work with, and she will help really set up the patient for setting up a proper intention. So for example, fibromyalgia patients, I use ketamine for them because of that central sensitization process, but also many of them have trauma in their past that usually, why does acute pain turn to chronic pain, and who is really going to be susceptible to chronic pain is a big question that we're wondering right now. There's a physical component, but there's that emotional sensory component as well. So the fibromyalgia patients, they usually will have some sort of trauma, or there's just been a big change in their life where they're depressed, they're not sleeping well. And so really having an intention, why are you doing this ketamine? Is it strictly for pain, or is it also bridging into mental health? So we're really helping multiple aspects of their lives, but it has to be done in a very safe surrounding, because they become very vulnerable at that time while they're going into this dissociation. It does help with pain, but it also helps to give them a lot of insight as to why they got here. And then the concept of cognitive flexibility, meaning it's like a snow globe. You kind of shake up, parts of the brain so that parts of the brain can communicate with each other. So afterwards, you actually have more possibilities. But a lot of these patients are stuck in this loop thinking that this is my life, and, these thoughts just continue. And we really need to give them, other possibilities and have them learn new things.
So you're on the cutting edge of this. What do you see for the future for using psychedelic medicine in treating your patients or other types of patients? And I know you're very politically active in this area, so I'd like to hear what the future is going to be.
Sure. I'm very excited for the future, just because as an interventional pain physician, I would have felt very stuck just doing what I was doing before. And now that I understand that chronic pain is more than just what's happening in the body, but there's this huge mind-body connection, I'm able to use ketamine right now, but in the future, psilocybin and MDMA will be available. And so MAPS is doing research right now looking at MDMA for PTSD and psilocybin for treatment-resistant depression. And they are in phase 3 for MDMA and phase 2 for psilocybin. And they're looking at safety and efficacy, but also durability. Because the problem with ketamine, for example, is it doesn't last long. The patients feel better, they need to work on therapy, integration, but then do they need more ketamine? We don't really want to get them in that cycle. The studies looking at the other classic psychedelics, you give 1 to 3 large doses of these medications with proper therapy, which is very intensive, and that's really important, that people don't realize that. People are just starting to think it's the medication, but the medication can only do so much if the patient's not doing the work as well. So I foresee that probably by the end of 2023, MDMA will be approved for post-traumatic stress disorder, where that would be through FDA approval. And the same thing with treatment-resistant depression and psilocybin, but that's probably going to be another 4 years. So MAPS has spent billions of dollars moving this forward, and many other universities have their own psychedelic centers right now where they're studying things for eating disorders and even neurodegenerative disorders. So they're using psychedelics for many reasons. There's a huge inflammatory component, but then there's also the experiential traumatic past of the patient that is very helpful for them to realize they're not their pain, they're not their trauma. And PTSD is kind of similar to fibromyalgia in that sense. It's more of a mental health component, and we look at fibromyalgia like chronic pain, but there's really that overlap because of that central sensitization.
That's real interesting. Is anyone working on DMT as a therapeutic agent?
Yeah, they are. And the thing about these psychedelics is that the onset and the duration varies based on the psychedelic. So DMT may be very fast acting, and that may be attractive to some, but for some of these conditions, the duration of the time the patient is spent in that either dissociation or psychedelic type of component is really, it's basically, how deep they could get into the session. So DMT is very fast acting. And so there also could be abuse in that sense. But there's research with all of these, and they're actually trying to just they're having like new entities, or they're trying to change the actual drug so it has a faster onset or shorter duration. Because imagine having the patient in your office for 6 to 8 hours with psilocybin. That's not really going to be productive except for the patient. So a lot of the new big pharmas are actually trying to change these drugs a little bit and make their own, which I'm all for, because they're going to eventually get FDA approval, and they're doing it in a very safe manner with the proper setting. So it's and looking at dose as well. So there's a whole paradigm shift. We're going from taking a daily dose of your antidepressant to taking 1 to 3 doses of a psychedelic with therapy and then being cured. The study that they did for MDMA and PTSD, 2/3 of them didn't have the diagnosis by 1 year after their experience. They're using it for end-of-life distress, with psilocybin for patients who need to find meaning towards the end of their lives. That's extremely important, having purpose before they pass away.
Wow.
That is
That's
important.
astounding.
Yes. In your practice, and you're dealing with a lot of different aspects of healthcare, pain, medicine, psychedelics. I mean, you have a broad scope to your practice. Are you running across anything that you think is significant with regard to longevity medicine? Are you seeing anything that really stands out as improving both the quality of life and potentially the quantity of life?
Sure. I honestly do believe that between cannabis and psychedelics, it's going to just revamp how we practice medicine. I think that everybody should be taking CBD, and there needs to be more research on the endocannabinoid system and actually how taking CBD affects our endogenous cannabinoid levels. We need a better way of actually monitoring that and testing that, because it's like a blood sugar versus an A1C. It rapidly turns over, so if you have a time of stress, it's going to be a different plasma level. I think so everybody should be taking a full spectrum CBD, and now things are regulated much more so that we know that they're safe. There's even studies that a small amount of THC, 1 to 2.5 milligrams, is helpful for people who do have chronic pain. But I think the psychedelic industry is going to be tremendous. I think that there's so many people right now that are dealing with disconnection, isolation, and trauma. And if we do the trauma work with them, I think they'll have a totally different life. And many people are just stuck, especially with the pandemic. So I'm not saying go do psychedelics, because again, they're all a Schedule 1 except for ketamine. But I do think that ketamine should be looked at as an off-label option for many different conditions, because right now the only one is treatment-resistant depression. And the challenge is the person who wants like the peak performance, next level in their life, they're going to look for these type of things. Cannabis helps you connect with yourself, so do the psychedelics, but cannabis can be a daily medication. The psychedelics is just really, you need a lot of preparation, you need the proper setting, and then you need the right team that can walk you through it. And then the most important thing is integration. And I'll say, I guess that would be, my answer. Integration means understanding what you just learned and then integrating it into your life. Otherwise, you're just using this medicine without having long-lasting effects.
I have to ask you this question because for years and years and years and years, cannabis has been so demonized by the powers that be. They just didn't want anyone to have access to it, and there were all these horror stories. You've been in practice with cannabis for how long?
6 years.
6 years. Have you ever seen any serious adverse side effects associated with cannabis use?
I haven't. I mean, the worst that happens is someone takes a whole gummy before bed, and I told them to take a half, and they get anxious, and eventually they'll fall asleep. So, I mean, the most negative side effects is basically taking too much THC and feeling high and not being able to control that high. But I really haven't seen many adverse effects from using cannabis, and if you use it properly and have CBD there, that will definitely help as a buffer. But there's not many. I prefer it over opioids, of course, especially to the senior population.
Does anything antidote CBD? If you get too high, is there anything you can take to bring it down?
Yeah, so you can take a lot of CBD, and that will decrease the high. You can use black pepper, which is basically found in beta-caryophyllene, which is one of the terpenes. And then you can just relax. I mean, it's really a psychosomatic type of thing. Your body starts to, your heart rate changes, your blood pressure changes, you're getting anxious. The CBD is going to calm a lot of that down. That may be the only mechanism for how it buffers it. We don't even really know, because it doesn't actually block that CB1 receptor. But that definitely helps to calm them down. But it's really reassurance. A lot of this is reassurance. And even with the ketamine sessions, sometimes when patients start to dissociate, they have a lot of fear. They're at that point at very high levels where they're negotiating whether or not they think they're about to die. It and brings out a lot of meaning afterwards, but at the time it can bring on fear. And that's like the ego, really. It's like ego disillusion. It's the sense of ourself, and our own personal narrative, who we think we are, is dissolving. And that's actually really important for people who have a false sense of who they are, or who are living, in a very uncomfortable mind-body connection.
Now, given the issues of the pandemic, which are so strong right now, some interesting papers have come out just recently on THC cannabis having an immune-stimulating effect, and perhaps mitigating the effect of CV-19 and perhaps other infectious diseases, and certainly some forms of medical marijuana are being used for cancer, and not just to improve diet or to improve appetite, but may have an oncolytic effect. Have you seen this work?
Yeah, I mean, the main reason behind it is cytokine storm. That's really what a lot of the papers point to. But the specific one about COVID recently was using the acidic cannabinoid CBDA, and then CBG, which is like the mother cannabinoid of the plant, and that's before the plant is decarboxylated, before it's heated. So the acidic forms are non-intoxicating, and then once it's heated, it becomes CBD or THC. And so that study was done using the CBDA and CBG, which means that if you're smoking, you're not getting that, right? Because you're burning it already. So there's a lot of use for, it all has to do with homeostasis. And I use, obviously, cannabis for cancer patients for nausea, vomiting, increasing their appetite. But then there's just that immune, boost that's happening, or the decrease in the cytokine storm.
Excellent. Well, thank you very much. I really appreciate your input. I'm sure our viewers do too. For the American Academy of Anti-Aging Medicine, I'm Dr. Ryan Klatz. This has been today's episode of Immortality Now. And be sure to go to worldhealth.net to learn more about what we're doing at the Academy, or a4m.com. Thank you again, Dr. Weiner.
Thank you.
Thank you for joining us for the A4M, worldhealth.net, and Immortality Now. Let me wish you a long and healthy and productive and happy life. God bless you.